Occupational health, hygiene, and ergonomics. So what is occupational health? So occupational health Joint Committee of WHO and ILO in a year 1950. So what is ILO? ILO is an international labor organization. So what is the function of ILO? So the function of ILO is the development and promotion of standard for national legislation to protect the people. So how about the WHO? The WHO is a World Health Organization that is responsible for international public health. So, it should aim at the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. So, occupational health prevention amongst workers of departures from health caused by their working condition. It is also the protection of workers in their employment from risk resulting from adverse factors. Then, placing and maintenance of the worker in an occupational environment adapted to his physiological and psychological equipment. And to summarize, the adaptation of work to man and of each man to his job. Occupational health, physical, mental, and social well-being in relation to work and work environment. Occupational diseases from preventive medicine point of view. Occupational diseases have a long latent period. Then most occupational diseases cannot be treated, but all occupational diseases can be prevented. So, we have here 5 occupational hazards. The first one is physical hazards, chemical hazards, biological hazards, mechanical hazards, and psychosocial hazards. So, there are route of exposure. The first one is inhalation. Inhalation is nahahamutan. So, like gas, vapor, aerosol, dust, fume, smoke, mist, and fog. It can cause diseases. So, in ingestion, it is the process of taking food, like eating and smoking. Kaya ano upodit eating? It is because diri kita maaram kung ano it aton gini-intake nga food nga may ada mga diseases na makaka-cause diseases. So, smoking gihap, it is not good to our health. And also, skin absorption, which is the primary irritation, the allergy, and the systemic toxicity. So next, the occupational diseases. Diseases due to physical agents. It is the heat stroke, burns. Burns nga ni bangayin laptok. Then, the cold, which is the frostbite. It frostbite, bagan namumula ni timkamot, danay nagiging bluish white. Then, ining halay, minor nystagmus, hamata inihiya nga diseases. Then, the pressure, which is the Caisson disease or embolism. When we say Caisson disease, mind inihiya nga disease, then an air embolism. So, ada inihiya blood nga nagtatrap hit aragian hit blood. So, next are diseases due to physical agents again. So, the noise, it can cause hypertension and irritability. The vibration, it can cause neuromuscular diseases, peripheral, and vascular diseases. Then, the radiation, it atong pag ginamit sa cellphone. It can cause leukemia and aplastic anemia. Then mechanical, it can cause injuries or accidents. Then the electricity, it can cause electric shock or burns. Next is the diseases due to chemical agents. So the gases, it can cause the CO2, HCN, the H2S, and the CS2. Then the dust, it is the pneumoconiosis. Then the metals, it is the lead, mercury, and curium. Then chemicals, the acids and alkalis. The solvents, it is the benzene and trichloroethylene. Next is the diseases due to biological agent, which is the hepatitis B, the rabies, the AIDS, leptospirosis, occupational cancers, the cancer of skin, lungs, bladder, occupational dermatitis, eczema, psychosocial disease, neurosis, peptic ulcer, hypertension. Those are the biological agent diseases. Let's move on to musculo-skeletal problem. So, it is due to excessive load on the muscles, ligaments, tendons, and bone. Then, due to insufficient circulation to the musculo-skeletal system. Then, work that requires activity of a small group of relatively weak muscles, such as continuous use of fingers of the dominant hand in data entry. So, here are the common sites of musculo-skeletal problems. The neck, the forearm. So, hinot diri maaram nga ni forearm. Forearm nga ni, ini nga aton sikotika diha may kamot. This is what we call our forearm. So, it wrist, liwat, amo ini nga aton, nagko-connect ha aton arm nga na aton hand. That is what we call the wrist. Also, the fingers, the back, and the knee. Those are the musculo-skeletal problems. So, here are the environmental exposures, which are the noise, induced hearing loss, whole body vibration, the Raynaud's phenomenon, the heat cramps or heat stroke, the dust-induced lung disease, the occupational dermatitis, and the occupational cancer. So now, let's move on to the elements of occupational health services, which are the medical treatment, the assessment and control of work environment, the general preventive health measures, and the preventive medical examinations. So we have here the medical measures, which are the pre-employment medical check-up, the periodic medical examination, the health promotion, health education, specific protection, and assessment of risk by supervision of working environment. So those are the medical measures. So next, in agricultural industry, there are 4 types of work, which are the seasons, unstable loading, the open air work, use of new technology and machinery, then the contact with animals, and biopreparations. So, in a seasons or unstable loading, physical work stress. So, it is risk of trauma and the overtension disease. While in open air work, weather condition dust, so it can cause overheating, overcooling, and also dust diseases. The third is with the use of a new technology and machinery, the noise and vibration can cause hearing loss, vibration diseases. Then the practices, fertilizers, or etc. is a chemical pollution of an environment and sensation, then allergic diseases. Then the last one is the contact with animals and biography. So it is the biological hazards. So it can cause zooanthroponosis. So let's move on to ergonomics. What is ergonomics? Ergo means works, then nomics means laws of works. So ergonomic means the laws of work. OSHA defines ergonomic as the science of designing the job to fit the work instead of forcing the worker to fit the job. So, there are three types of ergonomic. The first one is physical ergonomics. When we say physical ergonomics, it is a working posture, materials handling, repetitive movements, work-related musculo-skeletal disorder, workplace layout, safety, and health. So, when we say cognitive ergonomics, it is when a word cognitive, it is a mental, about mental. So, mental workload, decision making, skilled performance, human-computer interaction, human reliability, work stress, and training, as this mainly relate to human system design. Next is the organizational ergonomics, which is the communication, the crew resource management, the work design, design of working times, teamwork, community ergonomics, cooperative work, new work programs, virtual organizations, telework, and the quality management. So, those are the three types of ergonomics, which are the physical, cognitive, and organizational ergonomics. So, what are the goal of ergonomics? The goal of ergonomics is to improve the quality of working environment engineered to the capabilities of the human body. Then, to increase the efficiency and productivity by reducing fatigue. Then, the prevention of occupational injury and illness. The work quality improvement. The proactive ergonomics versus reactive ergonomics. So, what are the proactive ergonomics? Proactive ergonomics is gina-implement inihiya bisan waray pa injury nga nahinabo for us to be aware. Pero ang reactive ergonomics, it is a organizational goals and has the founding to properly support the best solution para hani kakaupay han mga employee or han as a whole organization. So, ergonomics has a rule. First is the straight back rule, the swinging arm rule, the straight wrist rule, straight eye rule, skin rule, no brain machine rule. So, next slide will show show a person that following are rules of an ergonomics. So, as you observe, that pictures that pictures shows that it is following the rules of an ergonomics. So, great posture is a great tool to help in prevention of pain. Here are another rules of ergonomics. So, adjust when you are in a computer or you are facing a computer, you just adjust the keyboard height so that your shoulders are relaxed, your elbows are in a slightly open position, 100 degree to 110 degree, and your wrists and hands are straight. Next slide will show you the good position of or when you are in a computer or facing in a computer. So, as you can see, the monitor should be placed directly in front of the user at approximately arm length and angled slightly backward. So, as you can see, his arm is padong tigadahan iya wrist. Okay, next, let's move on to the importance of occupational health and safety practices. So, why occupational health and safety practices is important? It is because occupational health and safety practices focuses primarily in protecting employees in a workplace from accident, injuries, and exposure to harmful substances. While accidents can happen at any time, it is still the employer's responsibility to ensure that they take steps to reduce the risk of incident and maintain a safe working environment. Yeah, so that is the employer's responsibility nga ma-reduce or ma-maintain a safe working environment. Prioritizing OHS at your business has several key benefits. So again, the OHS is occupational health safety. So there are several key benefits, including the reduced risk of accident or injuries by identifying and mitigating hazards, then improve efficiency and productivity due to fewer employees missing work from illness or injury. Then, to improve the employee relations and morale, because a safer work environment is a less stressful work environment. Yeah, that is true. Next is to reduce the cost associated with accidents or injury. So, the healthcare and rehabilitative costs, losses in productivity, impact on employees' well-being. Then, lower insurance premiums resulting from fewer workplace incidents and workers' compensation claims. Actually, wala ito secret nga magkaading industry have a safety hazard of some sort? No. The most important aspect of a good occupational health and safety policy is identifying these hazards and ensuring that employees have the training, safety equipment, and other resources needed to work safely. So, failure to implement effective policies and precaution can lead to injuries, reduced productivity due to the absence or loss of skilled labor, workers' compensation claims, and possible penalties from the Occupational Safety and Health Administration. So, that's the end of my topic. Thank you and keep safe, everyone.